Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your college of entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is our new series on infectious diseases. And for the next 2 episodes, we will be talking about the classification of bacteria. So the classification of bacteria is based on several things, including microscopic appearance, staining, such as gram staining, and other biochemical tests as needed. Gram stain, shape, and oxygen requirements, so whether deducing which class of bacteria the organism falls into, and then that has implications for its pathogenesis and also its treatment. This is quite a busy slide, but it summarises the differences between the 2 types of gram staining. So we have gram-positive bacteria and gram-negative bacteria. As to whether a bacteria is classed as positive or negative on gram stain is dependent on the cell wall thickness. So gram-positive bacteria have a thick peptidoglycan layer in their wall, whereas the gram-negative bacteria have a thin peptidoglycan layer surrounded by an outer membrane, and this affects how much of the stain the bacteria is able to take up. And subsequently, we have gram-positive bacteria appearing as purple or blue, whereas gram-negative bacteria appear more as pink or red. In gram-positive bacteria, this outer membrane is absent, but as we've just discussed, gram-negative bacteria do have this outer membrane, and it contains lipopolysaccharides or LPS. We can further divide gram-positive bacteria and gram-negative bacteria, or rather differentiate them, using other characteristics. So some examples are the toxins they produce. Gram-positive bacteria primarily produce exotoxins, whereas gram-negative bacteria primarily produce endotoxins, although they can also produce exotoxins as well. The susceptibility to antibiotics is also down to the makeup of the cell wall thickness. So generally, gram-positive bacteria are more susceptible to antibiotics, such as penicillin, that target the peptidoglycan layer, whereas gram-negative bacteria are often less susceptible due to the protective outer membrane that they have. We will talk more about examples of pathogens that fall into these 2 categories in a later episode, but as an example, some examples of gram-positive bacteria that you may hear about are Staphylococcus aureus and Streptococcus pneumonia. And in terms of gram-negative bacteria, the common ones that you may hear about are E. coli, Salmonella species, and Neisseria, for example, Neisseria gonorrhea. So now we come to shape and oxygen requirements. So these are also factors that can influence bacterial habitat, pathogenicity, and the treatment options. In terms of oxygen requirements, bacteria are divided into aerobic and anaerobic. So aerobic bacteria are those that require oxygen for survival, and anaerobic bacteria thrive in environments where oxygen is absent or limited. In terms of shape, there are 2 main shapes, although there are others which we will talk about as we go through the series. But the main ones are cocci, which are spherical bacteria, and these are found alone, in pairs, in chains, or in clusters. And there's also bacilli, which are rod-shaped bacteria. So here we have an example of a slide showing Staphylococcus aureus, and as you can see, they are bluish-purplish, which means they are gram-positive, as we mentioned before, and they also have this spherical shape, which are cocci. So we tend to say that Staphylococcus aureus exists as clusters of gram-positive cocci, which is evident from this particular slide. Conversely, this is an example of gram-negative bacilli. So this is an example of Pseudonomas Aeruginosa. And as you can see, there is a reddish-pink colour, and the bacteria are more rod-shaped, and that's where we can describe them as bacilli. So now let's try a question. Which of the following features is characteristic of gram-negative bacteria compared to gram-positive bacteria? So our options are a thick peptidoglycan layer, presence of teichoic acids, absence of an outer membrane, production of both exo and endotoxins, and a higher susceptibility to antibiotics due to cell wall structure. So you will remember from our table earlier that the correct answer here is D. Gram-negative bacteria produce both exo and endotoxins, whereas gram-positive bacteria only produce exotoxins. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.